these two things I'm holding. You see these two things. This is going to prevent your wound from getting infected. Hi everyone. Welcome to Postpartum with Precious. Right in this video, I'm going to teach you how to take care of your wound properly to avoid getting infected. Remember, if your wound starts smelling, like start having foul smell, if you start noticing greenish, yellowish thing inside your wound, you need to get to the hospital as fast as you can, because it is a sign that your wound or your incision is getting infected. I'm going to talk about this later in my next video. I'm going to talk about full time on wounds getting infected so that you're going to be aware of that. So check that out. Today we're going to be talking about how to take care of your wound. And guess what? If you have not subscribed to my YouTube channel, please click on this link, click on this button, and also turn on post notification on, because right on this channel we'll talk about everything pregnancy. So if you're still pregnant, you will join us soon. We'll talk about CS delivery, because I've had 2 CS. We'll talk about VBAT. I have had 3 VBAT. We'll talk about healing. We'll talk about recovering. We talk about adjusting to our new reality. We talk about postpartum depression and anxiety. We'll talk about how we're going to start coping in our new normal. We'll talk about everything that has to do with our baby, ourselves, our growth, and everything. So if you have not subscribed, please tap on the subscribe button and also tap on the notification bell so that you will be reminded anytime I put a video out there. So right guys, in this video, I don't want to, if you look at me, you notice that I'm not even like that prepared. I just saw this on my shelf and it just occurred to me that I promised I will give up this video. So I will be talking about it today. Now, you'll see these two things. These two things I'm holding. Actually, I have like 4 of them. So I'm going to be giving you like everything. Remember, I made it in my last video, I talked about 5 things you need to know before you carry your baby and leave the hospital. Number 1, I said you have to go back to your doctor and ask your doctor what are the do's and don'ts, because you need first-hand information from somebody that knows your inner system more than you. First thing I did was exactly that, and the doctor recommended this. Now, I don't know if you are not in Nigeria, I don't know if this is the same everywhere, but it is called KF Anti-Infect Antiseptic Solution. This is not an ad. You see, this is not an ad. This is not an ad. This is not an, I'm saying this is not an ad. This is exactly what I used. Now, I used it together with this. This is called normal saline. You can see it is still in the nylon. I've not even opened this because I got it many. This is normal saline. This is my cotton wool. So this is the process. So now this normal saline, there's something you need to know. Pay attention to this. Pay attention to this. When you open your normal saline, please, oh, please use your needle and open this saline. Now, remember, your wound is already there. Like you have opened it and you want to clean it. Remember, you just came back from the hospital and you're going to be cleaning yourself every 48 hours if the doctor recommends that, or maybe every 24 hours, depending on what the doctor told you. Now, when you take your cotton wool, remember, let's assume that this is already open. You don't do it like this. Don't do it like this, because whatever that is here, you might contaminate this normal saline. So you're going to pour it like this, like assuming that it is open. So you're going to wet your cotton wool with this normal saline. Some people use spirit, but the reason why I don't recommend spirit is that some of the spirits we have here are not ventilated. Some of them I can't trust it. Some of them might be too harsh. Some of them might even start opening your wound more. So this is like the best thing the doctor recommended for me, which is the normal saline. So when you use it, when you come to your wound, so assuming that this is your wound, you don't do like this. So this is what you would do. You're going to do like this. So you dab, like, this is like, follow the line, okay? You do like this. You come back, okay? So you change the side and you do it like this. You do it like, we remove this, you get another one, you do the same thing and you dab, okay? And you clean, okay? Don't do like this, don't do like that. So you do it like this, okay? And when you are done, you get this, okay? You get, that is if you are still wearing this, because some of us came back with this. I came back with this. So you get this, and you know, you place it on the incision like this, right? And you open this. I don't know if I still have anything left in here, but I really do not want to spoil this. So I'm just going to show you what it looks like. I don't know if you saw this. So this is exactly how you're going to like take it to straight to the wound. You are touching the wound. Okay, you can see what I did there. So it is straight to your wound. So like the same wound line, okay, the same wound line. And when you are done, you now use your plaster to hold here and hold here. You don't use your plaster to cover this thing, because your wound needs to receive normal fresh air. Like there should be air going through your wound, because the air will help your wound to heal. So this is what you do. Use your plaster here and here. So this is what I'm talking about. So assuming that your wound is here, use your plaster, hold here, use your plaster, hold here. Allow the wound, allow the air. If you notice, this is net. So air can pass through this. Okay, this is exactly how to care for your wound, and you can do this depending on what the doctor tells you, whether you're going to be doing this every 48 hours or you'll be doing it every 24 hours. If they tell you every 48 hours, be doing it every 48 hours until they tell you, okay, you don't need this thing again, you don't need the net again, you don't need to cover it again, you just open it. Because I opened my own, I think 2 weeks when I came back from the house, 2 weeks after my CS, they said I should open it. No, not 2 weeks, 1 month. I was using this until 1 month. It was when I went to the hospital, they now removed it. My first checkup, they removed it, and they used the same saline to clean me very well. And they asked me to leave it open and be cleaning it every day all by itself. So guys, I don't know if this video really helped you. If it does, please subscribe to the YouTube channel. Click on bell notification to turn on post notification. You can also share it to that woman that is still pregnant, so that they will know. Maybe anybody that delivers through CS, so that they will know. Because if you go to the hospital, you will see a amount of women that delivers through CS and they don't know what to do. They came back because their wound got infected. You don't want to do that. You don't want to be that person, you know, that knows that this person might get into serious trouble. I don't want to share this. Please do click and share. And like I said, in my next video, I'm going to be talking about signs that your wound is about getting infected. And on that video, we're going to dive right into it, and I will show you, because mine almost got infected. In fact, maybe at that time, I will not share my own incision. It was terrible. I don't want to share it, but I will in the next video. So if you have not subscribed, please do. And until then, see you on the next one. Bye.